Welcome to the Africa Diaspora News Channel. My name is Lynient Akotonou making this report. The COVID-19 era wasn't a good one. It wasn't at all. And it was a disease that no one expected. It changed the trajectory of things. People had to work from home. It changed everything. And right now, there is an outbreak. A new virus has been discovered. And it was discovered in India. Yes, family, India in Asia. Remember, COVID-19 was discovered in China. China in Asia. And now we have another deadly virus discovered in India. Let's check it out, family.
I want to walk through this carefully. 2 days after the U.S. withdrew from the World Health Organization, there is something that came out in India called the Nipah virus. I just want to walk through this very careful for you guys. First of all, let me say this. I cannot do 2020, whatever year it was. I can't do 2020 again. Am not. That's number one. Number two, this Nipah virus is very concerning for several reasons. Why haven't we cut off international travel immediately? Why? Now, I did see some updates. I'm saying that they have it under control and all this extra stuff. I just don't believe that. I don't believe that. So now 2 days after we didn't get cut off from the World Health Organization, something called Nipah virus. What they're saying is that it can spread via animals and humans, and the way it spreads is either a close contact or through food, or is linked to like a fruit bag. That confuses me in itself. Now, there are numerous countries across Asia, and what they started doing was introducing screening procedures at their airports so that it didn't enter their country. Why we ain't been doing that, I don't know.
This is a report according to Science Alert. Nipah virus. The name of the virus is Nipah virus. COVID-19 discovered in China 2019. And it broke out. It spread through the continents. It didn't just stay in Asia. It spread to Africa. It spread to North America. It spread round. We need to be aware of this, right? That's why we brought it to your table. This virus is said to be deadly, and it's called the Nipah virus. The Nipah virus outbreak has Asia on high alert amid death in India. An outbreak of the deadly Nipah virus in India has put many countries in Asia on high alert. Given the fatality rate in humans can be between 40% to 75%, that's a lot. Several countries, including Thailand, Malaysia, Singapore, have introduced new screening and testing measures after at least 2 people died of Nipah virus in the Indian state of West Bengal this month. But what is Nipah virus and how concerned should we be? Now, let's check it out, family. The Nipah virus, like Hendra virus, Nipah is in a category of viruses called henipaviruses. It is zoonotic, meaning it can spread from animals to humans. This virus can spread from animals to humans. Now, family, this virus is called the Nipah virus, and it is zoonotic and can spread from animals to humans. And it has actually been discovered, family, that outbreaks happen in Asia from time to time. The first outbreak was reported in 1998 in Malaysia. Family, there are 3 major ways it's transmitted. That's this virus. First is exposure to bats, like bats, and in particular via contact with the saliva, urine, or feces of an infected bat. Infections can also occur from contact with other infected animals, such as pigs in the original outbreak in Malaysia. The second way is by contaminated food, particularly date palm product. And the third way is from human to human transmission. Now, the Nipah transmission between humans has been reported via close contact, such as caring for a sick person. This can mean, for instance, being infected with bodily secretion contaminated with the virus in household or hospital. Now, family, what are the symptoms? You just saw how that this can be transmitted from humans, infected animals, contaminated food, animals, bats, right, as we read, right? And now, what are the symptoms? It's a terrible disease, and around half people who get this virus infection can die. That's what is said here. And the symptoms vary. It can cause pneumonia, just as COVID-19 did. Now, the symptoms include fever, seizures, difficulty breathing, falling unconscious, severe headaches, being unable to move a limb, jerky movements, personality changes, such as suddenly behaving oddly or psychosis. So, family, how worried should we be? The thing is, there is currently no vaccine. Yes, there is no vaccine for this. While they said they're working on the vaccine, they said there was a phase 1 trial of a particular treatment, but it didn't work. And now they said, how worried should we be? They said it is worrying because no prevention or treatment is available and it is severe. It's a severe disease. So, family, we have to be careful. I think we're going to go back to screening in airports. Before, the period of COVID-19, screening was a thing before you travel to another country because there are no treatments yet. Why is it always Asia? Now, I had to check this out and I got this. It's Asia because of the high population density. It's Asia because of rapid urbanization. It's Asia because of the intense human-animal interaction, according to recent analysis. I don't know what they love so much in animals. I'm not saying do not be animal friendly, but there are some animals you don't play with. Bats. Has bats been domesticated? But I won't be surprised, right? I won't be surprised because these guys can't do anything. Literally, they can do anything. So let's be careful out there. The symptoms listed, and they said it causes pneumonia like COVID-19, the COVID outbreak. So let's be careful. The symptoms, let's be careful. You want to travel now, this virus is actually out there, and there are no vaccines yet. The level of the phase 1 they tested didn't work. So yeah, we need to be kept abreast of this recent happening. What do you have to say about this story, family? Be careful, be careful, be careful. COVID-19, Asia. Nipah virus, Asia. Population in Asia is something else. Comment your thoughts and do not forget to share, like, subscribe, and turn on your notification button. My name is Lynient Akotonou. Thank you for watching.